Patients often come to the clinic and ask me whether they have epilepsy and what that means for them. 2 or more lifetime seizures separated by 24 hours that are unprovoked will qualify as a diagnosis of epilepsy. A single seizure with additional diagnostic information, either an MRI or an EEG, that demonstrates a high likelihood of having a second seizure within the next 2 years also will qualify as epilepsy. Why is it important to make a diagnosis of epilepsy? It's critical because we want to avoid future seizures at all costs. For the past 3 years, Hoag Hospital has had a Level 4 comprehensive epilepsy program. A Level 4 epilepsy center requires an epilepsy monitoring unit and the ability to diagnose and manage epilepsy in its most complicated forms. And that includes surgeries, implanted devices, advanced neuroimaging, and personnel that are specifically trained in the care of patients with epilepsy.
So Hoag Hospital is part of an epilepsy consortium with a lot of different hospitals in Southern California, Central Valley. And the main benefit of this really is that we're sharing resources and sharing ideas, but you're getting different takes from different people. And even though you may disagree, ultimately that helps the patient because then you're making sure you cover all the bases and cover kind of all the different perspectives of what to do.
Patients who come to see us in the clinic, oftentimes after the first or their second lifetime seizure, require an initial outpatient diagnostic evaluation. This generally involves a high-resolution epilepsy protocol MRI, which we offer here at Hoag, as well as an extended outpatient EEG. Those 2 studies typically will allow us to make the diagnosis of epilepsy or consider alternative explanations for seizures in most patients. Patients who either continue to have episodes that may be seizures or may not, or continue to have epileptic seizures despite medications, will require more intensive treatment and more intensive diagnostic work. For this, we have an epilepsy monitoring unit here at Hoag, where patients are admitted to the hospital, and oftentimes their anti-seizure medications are reduced in order for us to capture seizures.
So the epilepsy monitoring unit allows us to monitor a patient for 24/7 for however many days, typically about up to a week. For our refractory patients, it really is kind of the gold standard, again, for confirming the diagnosis and finding out where seizures are coming from. And so that's the first step in the pre-surgical evaluation. So seeing where the seizures look like on the scalp, and then based on that information, we can decide is more monitoring necessary, such as putting electrodes into or on top of the brain to monitor the seizures.
The Hoag Epilepsy Program is a unique program of its type. Neurologists, neurosurgeons, and neuropsychologists all work very closely together, both in joint case conferences and also outside of conference in direct patient care.
Neuropsychology is an important piece of the pre-surgical workup, and also just for folks with epilepsy in general to get a sense of where they're at. By getting a nuanced understanding of their strengths and weaknesses cognitively, in terms of their thinking and memory, we can strengthen or bolster the areas where there might be deficits relative to their peer group, and we can also help them have the best post-surgical outcomes if that's something their team is considering. The best case scenario is that someone has a baseline of their cognitive functioning, because then we can compare you to yourself down the road, and we can get more specific in terms of the changes that we can see from medication effects, from surgical interventions, just across the intersection of aging and epilepsy as someone continues to age. So having a baseline of a cognitive understanding is really important in epileptic care.
Over the last 5 years, there's been the development of several minimally invasive options for people with epilepsy. Some of these techniques include minimally invasive SEEG placement with robotic guidance, responsive nerve stimulation, vagal nerve stimulation, and laser ablation. All of these techniques significantly reduce the hospital time, significantly reduce pain, and increases the chance of seizure freedom. One of the unique features of our program is a patient support group, people who've had epilepsy surgery who can guide patients who may be considering this option.
Seizure freedom is possible after accurate diagnosis of the cause of epilepsy, appropriate medication management, and possibly referral for a surgical evaluation.